So imagine waking up one day and finding your shoulder has simply locked in place. You literally can't move it. Welcome to This Explainer, where we're going to dive deep into an incredibly painful and restrictive condition known clinically as adhesive capsulitis. Now, if you or someone you know has ever actually experienced this, you already know it's not just a minor ache, it is profoundly debilitating. Today, we're going to explore exactly how this condition develops, the fascinating biology behind it, and precisely how medical professionals diagnose and treat it based on its highly unique life cycle.
Real quick, here is our roadmap for today. We'll start with what is adhesive capsulitis, then the 4 stages of freezing, diagnosing the stiff joint, targeting treatment by stage, and finally, exercises for the thaw. All right, let's jump right in.
Look, to start us off, let's just validate a brutal reality for anyone suffering from this. You might find yourself agonizing over why this hurts the absolute most at night. Well, the pain is notoriously worse when you try to sleep, simply because your blood flow naturally slows down during the night. And you know what that does? That decrease in circulation actually increases localized inflammation. Plus, as you're tossing and turning in bed, you inadvertently put this agonizing pressure on an already stiff, inflamed joint. Honestly, it's just a perfect storm for nighttime discomfort.
Okay, section 1. What is adhesive capsulitis?
So the medical term is adhesive capsulitis. This happens when the strong connective tissue surrounding your shoulder joint, which we call the shoulder capsule, becomes intensely inflamed, thick, and stiff. Over time, you even lose the synovial fluid that normally keeps your joint all nice and lubricated. Now, the condition is widely nicknamed frozen shoulder for a very ironic and frankly cruel reason. See, the initial pain causes you to use the arm less, right? But that lack of use actually causes the joint capsule to thicken and tighten even more. It literally freezes in place as these thick bands of scar tissue form. Think about the anatomy of your ball and socket joint for a second. The capsule contains all the ligaments that attach the top of your upper arm bone, the humeral head, to your actual shoulder socket. When adhesive capsulitis sets in, thick bands of scar tissue, known as adhesions, physically bind that humeral head straight to the socket. It is a structural lockup, and that's exactly why simply pushing through the pain isn't a viable option here. It's physically stuck.
Moving on to section 2, the 4 stages of freezing.
You know, the craziest thing about this condition is how the symptom profile completely flips over time. And this is exactly how clinicians diagnose it. In stage 1, the pre-adhesive stage, you suffer extreme pain due to active synovitis, which is inflammation of the joint lining, high irritability. But eventually, by stage 3, the frozen stage, that inflammatory pain basically burns out and drops to a minimal level. But here's the catch. The diagnosis shifts entirely to capsular contracture, just rigid, stubborn stiffness. So a doctor figures out exactly where you are in the cycle by evaluating this highly specific ratio of inflammatory pain versus mechanical stiffness. And unfortunately, this cycle is not quick. This condition is intensely debilitating and can last anywhere from 1 to 3 entire years. The initial freezing stage alone can last 6 weeks to 9 months. The frozen stiff stage can linger for another 4 to 6 months after that. And the thawing stage? That can drag on from 6 months up to 2 years. However, there is a silver lining here, and it's what you should really take away from this timeline. Frozen shoulder is generally a self-limiting ailment, meaning even without extreme interventions, it will eventually enter that thawing stage and resolve on its own.
Which brings us to section 3, diagnosing the stiff joint. So how do doctors know for sure? A definitive clinical diagnosis is actually made by being a bit of a medical detective and comparing 2 specific types of movement right there in the clinic. Active range of motion is when you try to lift your own arm using your muscles. Passive range of motion is when you completely relax your muscles and the doctor tries to manually lift your arm for you. Patients with a true frozen shoulder will exhibit a severe limitation in both active and passive ranges. Because the joint capsule itself is glued shut with scar tissue, even when the doctor does all the work, the arm simply will not move past a certain point. If your doctor can easily lift your relaxed arm but you can't lift it yourself, well, you're likely looking at a muscle tear, not a frozen shoulder.
Now get this. Surprisingly, this condition heavily targets very specific demographics. Why is it that adhesive capsulitis affects an estimated 10 to 20% of all individuals with diabetes? That's a massive overlap. While researchers are still studying the exact biomechanics of this strange link, the metabolic changes associated with diabetes clearly create a much higher risk for the connective tissue to inflame and stiffen up.
And beyond diabetes, we also see the highest risk in women between the ages of 40 and 65. People with thyroid issues, specifically hypothyroidism, are also highly susceptible. But crucially, and this is something you can actually control,
A major risk factor is prolonged joint immobility. If you have kept your shoulder perfectly still, say in a sling, for an extended period following a minor injury or surgery, you are drastically increasing your risk of that joint capsule freezing up on you.
Section 4. Targeting treatment by stage. So in the early stages, right, stages 1 and 2, the primary enemy is active synovial inflammation. Getting a corticosteroid injection during these first 3 to 9 months can be a total game changer. It rapidly resolves symptoms by directly attacking that inflammation. But, and this is incredibly important, there is absolutely no clinical indication for steroid shots in stages 3 and 4. None. By the time you're in the frozen or thawing stages, the inflammation has already burned out. The enemy is now capsular contracture, the physical scar tissue. So in those late stages, targeted physical therapy and stretching become the gold standard to physically break down that stiffness.
And finally, Section 5, exercises for the thaw. According to the sports medicine protocol over at Mass General Hospital, the key to physical therapy here is absolutely not aggressive forcing. You want smooth, gentle stretching. Movements like the pendulum, where gravity basically helps you create small circles with your arm, or things like tabletop arm slides and supine external rotations. These are heavily recommended. They are the safest and most pain-free ways to slowly melt away those final capsular restrictions. Pushing too hard or too fast can actually trigger the inflammation all over again, so it really requires patience and gentle consistency.
So, wrapping this explainer up, let me leave you with this thought. Knowing that prolonged immobility is a huge trigger, how can you adapt your daily routines right now to protect your joints from the long, painful winter of a frozen shoulder? While resting in injury is definitely important, maintaining safe, active movement or seeking immediate physical therapy after a minor setback might literally save you from an agonizing, years-long condition. Thanks so much for joining me today, and keep moving.